Hello, welcome to ANA community. In this particular video, we are going to discuss the concept of the examination of tongue in general examination. So far, from the several videos, we are discussing about the general examination, its significance, and different factors examined under general examination. Today, we are going to discuss the examination of the tongue, its significance in general examination. The examination of tongue. First of all, we need to know about the brief structural anatomy of the tongue. It has two surfaces, that is a dorsal surface and ventral surface. Each of the parts are having its own significance as far as general examination is concerned. This is considered to be the tip of the nose, the one which is having the purple colored arrow, that is showing the tip of the nose. This is considered to be the base of the tongue, and this is considered to be the lateral border of the tongue, and this is considered to be the dorsal surface, that is which is on protruding the tongue. We are going to visualize the dorsal surface of the tongue. When you are turning the tongue towards the palate, then we are going to see the ventral surface. So this is considered to be the frenulum lingulae, exactly the midline. We are going to see the fusion. This is considered to be frenulum lingulae. Actually, this is the one which is responsible for the protruding of the tongue. If this is shortened frenulum lingulae, then the person will be having the tongue tie. This is considered to be lesser sublingual ducts, which is responsible for the secretion of the saliva. Now, we are going to discuss some of the abnormalities that we are going to see in the examination of the tongue. In this particular image, we are going to see the depapillated tongue. Depapillated tongue, normally tongue will be having the rough surface due to the presence of a papilla. When the person is having anemia, this particular papilla, they are going to get diminished, or they are going to have the person will be having the smooth tongue. This is considered to be the bluish discoloration of the tongue. So this is just like when the person is consuming what is a jambu phala, then the person will be the similar kind of the discoloration will be observed. This is indicative of the excess presence of the deoxygenated blood as such, which is specifically seen in major respiratory diseases or major cardiac diseases. This has been termed as central cyanosis. This is considered to be a geographical tongue. So this is indicative of a poor oral hygiene. When the person is not maintaining the hygiene properly, then the person may have this particular type of the tongue. As a hereditary component, that means this particular type of the tongue may run in families. It may be observed in cases of fissured tongue. It can also be seen in cases of the autoimmune conditions or inflammatory conditions such as psoriasis or eczema. It can also be seen in the person who are having the allergic manifestations. When you think about this particular phenomena, this is considered to be beefy red colored tongue. This is specifically seen in the person who is having vitamin B12 deficiency. This is considered to be pallor, where the person will be having the yellowish white colored tongue. It may be associated with depapillated tongue, where the papillae will be absent. This is specifically seen in the persons who are having anemia. This is considered to be fissured tongue. This is specifically seen in the persons who are having Down syndrome. In case of vitamin B deficiencies, in case of psoriasis. Psoriasis is a skin disorder, whereas it is considered to be present in case of Sjogren's syndrome. It's a rheumatic disease as such, where the person will be having the joint pain as well as salivary gland involvement. In case of hereditary component, that means it may run in families. There may be a possible trauma to the tongue, may have this kind of fissured tongue. This is considered to be candidiasis. In case of fungal infections, this may be observed. This may be associated with whitish colored discoloration in the oral mucosa also, or buccal mucosa also. This is considered to be carcinoma of the tongue. That is where the person will be having cauliflower-like growth in part of the tongue. So here it is being present in the ventral surface of the tongue. Sometimes because of this tongue comes in between the teeth during chewing or swallowing, there may be a frequent, if the person is having this particular trauma, that may be another indication of the development of carcinoma of the tongue. This is considered to be dry tongue, specifically seen in case of the person who are having dehydration, who are having the excessive loss of the fluid, such as excessive sweating or excess diarrhea, or if the person is suffering from the severe fever or hyperpyrexia or chronic fevers or pyrexia of unknown origin. In those situations, this may indicate the dryness of the tongue, dry tongue. Ventral surface of the tongue is considered to be the earliest indicator for the diagnosis of hepatobiliary diseases, because in case of the latent jaundice, that means clinically unmanifested jaundice, the person may have the yellowish discoloration is specifically observed in the ventral surface of tongue before observing the yellowish discoloration in the sclera. Hence, whenever the tongue is being examined, ventral surface of the tongue, that will be observed first. So this is a fasciculation of the tongue. If you see this particular, the QR code, you can see this particular image or the video where the involuntary movements of the tongue that is being observed, which is an indicator of the presence of motor neuron disease. Now, as far as the Ayurveda aspect of Jihva Pariksha, one of the thing that is being considered, that is aliptasyata and liptasyata, which is nothing but coating over the tongue or absence of coating over the tongue. Whenever the person is having a digestive impairment, the initial aspect that will be observed will be sympathetic nervous stimulation. When there is sympathetic nervous stimulation, that will be responsible for the decreased secretions to happen in the whole alimentary canal. That means decreased salivary secretion, decreased gastric secretions, decreased intestinal secretions, or decreased large colonic secretions. This may be associated with closure of the sphincters. That is closure of upper esophageal sphincter, closure of pyloric antrum or closure of the ileocecal junction or closure of the anus. That is the activation. That is when there is activation of the sympathetic nerve stimulation. Because of the reduced secretions that is in the oral cavity, one of the things that may be responsible for the that is what we can say, that is because of the poor oral hygiene. So as the person is having the more consumption of a carbohydrate rich diet, there will be a possibility of a proliferation of bacteria in the oral cavity. When there is proliferation of bacteria, the oral cavity, because of reduced salivary secretion, where lysozyme will be observed present in the salivary secretion, which is considered to be acting against the bacteria. As there is reduced salivary secretion, the person will be having proliferation of the pathogenic bacteria, which is associated with the presence of the coating over the tongue. When the person is having the fever, the person will be having reduced digestive secretions. And when there is reduced digestive secretions, so that is includes even salivary secretions too. Because of that, the person will be having the proliferation of a pathogenic bacteria in the oral cavity. Because of that, these pathogenic bacteria that start entering into the parotid duct, which is being present on the upper surface of a second molar. So which is being termed as Stenson's duct also. That means when there is a person is suffering from the fever, because of that there will be reduced salivary secretions. This is responsible for the increase of pathogenic bacteria in the oral cavity because of reduced salivary secretions. Because of that, this may be, and these pathogenic bacteria will be start entering into the parotid duct. That is from the simple principle of a movement of the substances from the higher concentration to lower concentration. Because of that, the person may develop the parotid swelling, which is being termed as the, in Ayurveda, who is suffering from Sannipata Jwara, they may develop Karanamulika Shota or Karanamula Shota, which is one of the Upadrava that is mentioned for Sannipata Jwara. So like this may be considered to be that is the examination of the tongue or jikva will be helpful in the diagnosis of the diseases as such. The take-home messages from today's discussion, today's video are: tongue is considered to be one of the important aspects of general examination. It is considered to be the mirror of most of the alimentary canal diseases or some systemic diseases also. Its discoloration, abnormal texture in terms of the excessive moistness or dryness, etc. Presence of coating over the tongue has to be noted. Cyanosis may be observed in case of major cardiorespiratory diseases. Icterus may be observed, or yellowish discoloration may be observed in case of hepatobiliary dysfunctions. Pallor may be observed in case of anemia. Presence of the coating over the tongue may indicate digestive impairment, etc. can be predicted. Dear ANA members, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below, and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.